We have just concluded the Digital Health Week Conference Kenya under the Transform Health Kenya Coalition, and we have done this as a partnership of the coalition led by Kelin, and also partnership with Farm Access Kenya, which is a member of the coalition. In fact, it's one of the founding members of the coalition.
It's a Digital Health Week that happens every year. We have actually been able to learn that through digitization, we are able to enhance transparency, accountability, and use of health funds. And this actually translates to improving patients' or people's experience while visiting the facilities, and also improving on the health outcomes.
It comes at a time that we are getting a lot of goodwill from the government. We just launched universal health coverage nationwide, but we just signed, as a country, just enacted 4 UHC bills. So this week is a week of action and a week of conversations around how we are going to improve service delivery in healthcare as a country.
This conference marks a very important turning point in the history of digitization of the health sector, because it has exposed us to what digital health is all about, the implications of digital health in our daily space, the advantages that digital health can bring to us as individuals, as facilities, the sector that we represent, be it private sector, faith-based, or the state, because the digital space is fast changing since technology is evolving very fast. Where we are right now, we must adapt technology or we perish. And in the health sector, technologies can bring us a lot of advantages. It will address a lot of challenges that we are facing in the health sector.
Technology allows us to connect all the pieces and all the players within the sector. It is essentially the glue we need to achieve universal health coverage, because patients require patient-centered healthcare, and patient-centered healthcare means that wherever the patient moves to, wherever the healthcare consumer moves to, the systems are interconnected so that the next provider knows what to expect and what is required.
So this has been a good experience and a good platform for knowledge sharing, and we're happy that we managed to have this conversation with over 100 participants from different organizations, different institutions, private sector, government, communities, and representation from counties. So it has been an interesting week, and we are happy that we have things to focus on when it comes to the advancement of digital health technologies in Kenya.
It also comes with its own downfalls. We have seen that there's also the profiling of people living with HIV, especially key populations. It has been very detrimental to know that your information is out there and you don't know who is accessing it.
So we have had very rich discussions on digital health technologies. We've had discussions based on community expectations when it comes to digital health technologies. We've spoken to youth and heard about their digital health concerns and the opportunities that they have seen when it comes to digital health technologies. We've spoken about key populations and their expectations when it comes to this digital health technologies framework and the use of data. We've spoken to women who have given us their experiences when it comes to using the technologies, that is not only in urban centers but also in rural centers and informal settlements, focusing on people with different abilities or differently abled individuals. And takeaways from this conversation or this conference is that we need to put a little bit more effort when it comes to adoption and use of digital health technologies.
And we are really humbled to be part of this, and we know that in the near future we are going to have systems that are very inclusive and that create synergies even within the KP programming within Kenya.
So my takeaway from this conference today is that African governments and the actors, civil society experts and regulators, policymakers now have to benchmark on Kenya, because Kenya has demonstrated leadership and commitment towards the realization of health care services through digital tools. Thank you so much.
We need to meaningfully engage the youth and the elderly, especially the aged, as end users of these digital technologies. It is also important to ensure that we have the digital innovations to be relevant to the specific county context or to the local context within which, because that really enhances the adoption.
And therefore, as we live here, we are convertees, we are converted. Let us be the great apostles, that we are going to preach the good news that Kenya is going to take off, and that the benefits of digitization will make us move much, much faster towards achieving the aspirations of universal health coverage and the aspirations of our Constitution 43, Article 43(1)(a), so that all Kenyans have a right to the highest standard of health.